Exactly where? What part of my lung? The terminal ends of the respiratory system. What do we call those little grapes? The alveoli. Da, da, da. All right. Why do they collapse? What can I do to keep them inflated? Gotcha. Think about a post-op patient. What does an incentive spirometer promote? Deep breathing, deep inhalations. I used to love it. We'd hand an IS to somebody and they sit there and they go, I'm like, no, bugger. I want you to. Because the more you inhale, the more these guys open up and stay open. If you think about, if I'm holding a, magnified 10,000 times, if I'm holding an alveoli in my hand, okay, this side is the venous capillaries on the outside of it. This side is the arterial capillaries on the outside of it. This movement it does when you take those deep breaths, that's what causes gas exchange from the alveoli to the outside blood and from the blood into the alveoli. All right? This movement is what causes the gas exchange. So if I'm not keeping them inflated by taking deep breaths, they do this. What type of gas exchange do I get now? Nothing. This is why patients end up with pneumonia.
Should we promote getting them up too?
Yes, yes. But atelectasis leads to pneumonia.
I didn't say pneumonia. I was confused when you first said.
What do you want to say?
Everything like osteoporosis or something like that.
Okay.
I don't know.
I was taught atelectasis.
Okay.
Leads to pneumonia. How do we prevent it? IS, turn, cough, deep breathing. Get your ass out of that bed. All right. You have a patient who has a history of previous renal calculi. Easiest thing you can do to teach him to decrease the risk of it coming back.
Drink water.
What?
Drink water.
Drink water, not fluids. Water. How much?
2 liters a day.
At least 2 liters a day, preferably 3. Water, water, water. Remember, we are ugly bags of mostly water. According to the Star Trek aliens. Speaking of kidneys, you guys remember the renal diet? I know I put it on the board. Huh? High protein, low what?
Low salt.
Low sodium.
Low potassium.
Thank you. Say it loud for them and back.
Low potassium.
Low potassium. Better know your sources.
So it was high protein, low sodium, and low potassium?
Just reduce foods and potassium. Okay, you have a patient. Remember, every question is scenario based. So every time you look at a question, I want you to picture, hi, I'm Jamie, I'm going to be your nurse today. Can you please tell me your full name, date of birth? And then you figure out what's going on. And then you come up with your possible answers. You solve this problem, you go to the next room. Hi, I'm Jamie, I'm going to be your nurse today. Can you please tell me your name, date of birth? Blah, 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 figure it out. Every single question is a different scenario. Do not, please don't do this. Do not try and go, well, last question was about this, so that means this one's this way. Don't do that. Don't do it. I can't walk around and hit you on the back of the head and make you stop doing it. I wish I could. You guys ever play that whack-a-mole game? Any of you guys ever watch NCIS? I swear to God, I'm going to pull Jethro Gibbs on you. Back of the head, knock it off. All right. You have a patient. Oh, look, it's another room. You have a patient who is having peritoneal dialysis. Peritoneal dialysis. You suspect giving what she presents as that she might have peritonitis. What would you be seeing?
She's in pain. Her stomach is big.
You're on the right track. Okay. Is their abdomen going to be big or small? Distended. What do we call it when it's tight? Firm. Board-like.
Board-like.
That's why I'm tapping on a board. Are they going to be complaining of maybe nausea and vomiting?
Yes.
If they're sick enough, they're going to have mental status changes? Absolutely. So it's the puking, yeah? The dehydrated. Peritonitis. Peritonitis. All right, different room. Different room. Patient has had hemodialysis yesterday. You need to assess his right AV fistula. What do you do? Come on, guys, it's the dance move.
Feel for thrills.
Feel the thrill, hear the bruit. You literally take your stethoscope and gently lay it on the skin of the AV fistula, and you're gonna hear, it's the blood flow. You want to hear that. Totally off topic, sidebar. When you guys are doing an abdominal assessment, we do the 4 quadrants, right? 1, 2, 3, 4. Just for giggles, stick it on the belly button. Because if you hear a guess who's got an AV? No, he's got a AAA. Aortic abdominal aneurysm. You can hear it if you listen on the belly button. If it's big enough. That's one of the tricks I was taught many years ago. When you do an abdominal assessment, it's not 4, it's 5. It's 1, 2, 3, 4, 5. It's right at the umbilicus. You'll hear it right at the umbilicus.
And you said they'll talk about
You'll hear a brewing,
and but that would be a
a AAA. And that is not on the test. Like I said, it's like that. All right, you are working at a clinic, and a very spry, 66, what's spry mean? You guys know what that means when I say a spry 66-year-old woman comes in? Huh? Active, very active, very well-dressed, full of energy. A very spry 66-year-old woman comes in and wants to talk to you privately about girl things. And she says, man, ever since I hit menopause, it hurts to have sex. What can I do to make things easier for me and my beau? Her boyfriend. Her beau. What can she do? Lube. You go down to CVS pharmacy and you buy lubricant. Why? How old is she?
Old enough.
Menopause. She's postmenopausal. The older we get, parts like, gravity works and things dry out. Everything goes south and then things dry out. Could also be drugs can dry you out, right? Speaking about menopausal, different menopausal woman says, I'm thinking about doing some hormonal therapy because I'm postmenopausal. Sorry, guys. What happens when I talk for 4 hours straight? I get dry. I'm thinking about doing some postmenopausal therapy. What do you need to ask about her history? What kind of cancer?
Breast.
Thank you. Breast. Good job. Good job. You need to make sure they don't have a history of family breast cancer.
Why is that?
Huh? Because it puts them at higher risk if they start the estrogen therapy.
High risk to get cancer.
They got a family history, number one, they're already at risk, and then you get them hormonal therapy, you just turned it on. Does that make sense?
Yes.
Especially if they've got like BRCA1 or BRCA2. You start hormonal therapy, you just flip that switch. Good questions.
It doesn't affect the thyroid or parathyroid?
Right now, I just want you guys, we're talking about breast cancer. I ain't worried about the thyroid right now. Okay, I'm not trying to shut you down, I'm just telling you, that's what I want you to focus on. Let's go down the other rabbit hole. Okay, so you got a patient, another patient, going into another room. Okay, you've got a patient who just had a right breast total mastectomy. How are you gonna take care of her post-op? She's 1 day post-op. Compression what? What else?
A bunch of pillows. Bunch of pillows.
Do I mess with this arm?
No, you take blood pressure, everything on the
No BP, no IVs, no nada. Totally sidebar, and I won't quiz you on this, but if you want to teach them how to do an exercise to increase their range of motion, teach them the wall crawl.
Yeah, that's a good one.
You see what I'm doing? And then they lean into it. Because they'll lose range of motion in this part of the breast. I won't test you on it, I just thought it was a cool trick. Wall crawl. Is she gonna have a drain?
elevation.
What kind of drain? JD. One of your alumni, 5 years ago, ended up getting diagnosed with stage 3 breast cancer at the beginning of her senior semester. And had to have a massive lumpectomy right before graduation. And she says, damn it, I'm coming to pinning, I don't care if I have a JP or not. She did. She had a JP pinned to her gown. A brave young woman.
Did you say the elevation?
Okay, different gal had a hysterectomy. What kind of education do we need to give her? Before she goes home, what is she allowed to do and not allowed to do?
Not for that stuff.
Huh?
Don't pick up anything.
No heavy lifting, I like that. What else?
So nothing heavier than a
Huh?
teacup.
She should have a light cycle, very good, I like that. If it suddenly turns bright red, we got a problem, huh? Or if it turns into foul smelling discharge? What about having intercourse?
No, nothing in.
Nothing in. Here's a good rule, my dears. Nothing in for 4 weeks. Nothing in for 4 weeks. All right, we've been talking about the girls enough. Let's talk about the boy type people. When should the boy type people do testicular self exams? In the shower or in the bath? How often? Once a month, just like the girls. What does testicular cancer look like?
Pea-sized, painless nodule.
Small, pea-sized, painless nodule. Okay. I'm gonna write another word on the board. You have a renal patient, and the doctor has just prescribed epoetin alpha for kidney disease. Anybody know what that drug's good for? It makes red blood cells. You're awesome. Makes RBC. So what do they have to have, say it? What do they have to have in their diet in order for that drug to work? Iron foods. Iron-rich foods. God, we're working in the kidneys. That's long.
No, I just read the slide for the kidneys. I read it first. The first class I read, it goes in my head and the other one's just.
So the kidney one.
So it is you gotta have iron or that drug's not gonna work. You can't make RBCs without iron. What are some iron-rich foods? Leafy green vegetables and red meats. Red meats. What's the rule about iodine, dye, and shellfish?
You're allergic to shellfish, you're allergic to
99% of the time, yes. 99% of the time.
The dye procedures.
Anything that has a contrast in it.
Benadryl.
If they say, well, you can pre-med, but 99% of the time, if that patient says, I'm allergic to shellfish, they do not get contrast. Most of the old contrasts were made with iodine.
Didn't they use glucose?
They can. I've also absolutely pre-medded patients till they were almost comatose with Benadryl and steroids because the doctor was like, allergy be damned, we gotta use the contrast. And I'm like, oh shit. Okay, I'll walk around with my box of that in my pocket. They did that to my ex-girlfriend. She had to have a MRI of the spine with contrast at Mayo in Phoenix. I knew the radiology tech that was doing it. She's reading it, and she, we had to do 2 days of pre-meds to boost her system so she might be able to tolerate it. The nurse that was in radiology literally went, you can give that faster than I can. She opened up the crash cart, handed me the EpiPen. Because she knew I worked on the heart floor and that I could shove that thing together in like 10 seconds or less. And in. Handed me the EpiPen. I was like, oh. She did fine. Had a hell of a headache though. Alright. Symptoms of hepatitis A. Why do folks not realize they may have hepatitis A? Huh? Can it what? No, it's not the fact that you don't have symptoms. Hey, say it louder. Flu-like symptoms. Hep A is nausea, vomiting, body ache, chills, diarrhea. Everybody thinks, oh, it's just the flu. Wrongly.
You said vomiting?
Flu-like.
There you go.
Think stomach flu. Diet restrictions for GERD. Carbonation, I like that. Alcohol, caffeine. Where does caffeine like to hide in Miss Howard's life? Hide. I know it's in my coffee. Somebody said it, I thought.
Chocolate.
Chocolate. Not my cigarettes. There's no caffeine in smoking. I just bombed that question, didn't it?
How come you?
It hides in my chocolate.
Really?
No caffeine. No alcohol. Knock off the smoking. Spicy foods.
Damn.
Right? Doesn't that suck? It hides in my chocolate.
You said it hides in your chocolate?
Yeah, caffeine's in chocolate. Pisses me off, especially since I love dark chocolate. I spend about $12 a week buying a bag full of Ghirardelli gourmet chocolates. And then I ration them out every night. I can have 2 pieces. And that's it. What's guaiac testing and why do I do it?
See if there's blood in the stool.
Abdominal bleeding, somewhere in the gut. If it's higher in the gut, what's my stool color gonna be?
Dark.
Tarry black.
What was the question? I'm sorry.
What's guaiac testing? Why do we do it? Guaiac. It's also called occult blood. So check for blood in the stools. What does, if I've got a bleed high in my gut, what is my stool gonna look like? Black tarry. If it's lower in my gut, frank red blood. Good. Yes. I love it when a plan comes together. You guys remember what a TERP is? Transurethral resection of the prostate. What is CBI?
Shit. Think about something else.
Continuous bladder irrigation. Do you remember the management of it? We have to what? No, this one right here, that was when the doctor's checking for the prostate. Make sure the color's right. What color is it supposed to be? Rosé, pink. It should be like pink lemonade. What happens if it turns bright red? What's happening?
Bleeding.
He's starting to turn dark red. What do I do as a nurse to the CBI? Turn up the flow.
If it's frank red?
If it's frank red, it means he's bleeding. I turn up the
pressure.
flow to make
Yes.
pressure inside the urethra. Good. What if I realize it's not flowing out?
Check for kinks.
Check for kinks. What else do I do? There's no kinks.
Irrigate it?
Irrigate it.
You have to ask.
What? I have to ask. Very good. Why do I have to ask? Because it's invasive. Do I just shove that, 80 cc's of sterile water in there super hard? Gentle irrigation. Because I'm trying to dislodge what? Clots. Yes. See, you guys know more than you think you know. What is cholecystitis? Gallbladder. Gallbladder what? Inflammation of my gallbladder. What causes it? Stones, diet. Love it. What are the diet restrictions for somebody who has cholecystitis?
No.
No fatty foods.
No fatty or greasy foods.
You're guessing. Somebody said earlier.
Fatty and greasy foods?
Fatty, greasy foods, spicy foods. Diet restrictions for cholecystitis. Go down that rabbit hole a little bit. Since we were talking about cancer, do you guys remember your stages of grief?
Yes.
Stages of grief.
Parkinson's, depression,
You guys better be able to spot it. I'm gonna give you a scenario and I'm gonna say, where is this patient? Okay? Actually, warning you, like that one, right?
It's probably anger.
Seizure types and care of a seizure patient. And we turn their head, and we throw a pillow. Yes? Do I loosen clothing?
Yes.
Loosen the belt, loosen the collar. I want them to be able to breathe. Safety, safety, safety. Know the differences between Parkinson's, stroke, and I mentioned it at the beginning of the day, multiple sclerosis. You're gonna have to go look that one up. I got a whole slide presentation for MS up there. Go look at it. I had a choice. I could either do a review with you or I could do MS. I thought you'd like the review better.
Yes, we do.
Types of strokes and the symptoms you're gonna see for a possible stroke patient.
You said type of stroke
And symptoms.
Was it what we learned today, the ischemic and the hemorrhage and then the access?
I think that was like, was it
Hemorrhagic.
Hemorrhagic.
Hemorrhagic. Heme as in blood. Hemorrhagic. That's the one where you got the blowout and the blood vessel. Any of you guys ever had a bicycle tire that had a blister on it and then all of a sudden it blew? That's a hemorrhagic. Think about it.
Long vessel.
How do I know that that liquid coming out of that kid's ear is CSF?
It's clear.
Check for
Yeah.
glucose.
Clearing and check.
What do I use to check for the glucose? Dipstick. Dipstick.
Have you said how to know what?
CSF. Cerebral spinal fluid. Remember that story I told you about the kid that got hit in the head with baseball?
Yes. I just wanted to know the initials. I knew it.
Cerebral spinal fluid, CSF. How are you on your therapeutic communication skills?
I'm okay.
The worst insight. When there's like.
Do you guys know who Dr. Von Hume is?
Yeah.
She's the most mellow chick I have ever met in my life. If you want to know how to answer your psych questions, I want you to picture yourself, how would Dr. Von Hume say this? How would she answer this question or ask this question? Because she's so mellow. Oh, can you tell me how you feel about that? Why do you think that? Right? She doesn't. Well, you're just being a baby bone. You know, she's non-judgmental, right? I'm picking on you. I'm sorry. But she's always non-judgmental, not jumping to conclusions. What else? Open-ended questions. Because you're always trying to get them to explore their own, the patient's own feelings.
You know what gets me though, is that last semester they were like, don't ever ask why. But then every person's like, well, why do you feel like that? And then that's always the right answer.
The main thing is you don't ask yes or no questions. Don't ask yes or no questions. Are you feeling like you might want to hurt yourself? Yes. That's the only one that you can actually ask.
Okay.
Okay, because on a suicide watch or a suicide patient, my wife loved this when I gave this in lecture when I was teaching that class during COVID. She's like, you really asked them? Are you thinking about hurting yourself? Yes, you do. You get in their face and you have to ask them, are you thinking about hurting yourself or hurting someone else? Do you have a history of previous suicide ideation or action? Because that is going to tell you that this is a higher risk. If they've tried it before, they're going to try it again. All right? Do they think they're going to harm themselves? Do they have a plan to harm themselves? Do they have a way to act upon that plan? That's the 3-step method. Do you want to hurt yourself? Yes, I feel like the world would be just better if I was gone. Okay, you have a way to do this? Yeah, I'm just going to shoot myself. Well, do you have a gun at home? Oh, hell no, I hate guns. Psh, did you see how it fell apart? Yeah, Jan used to laugh at me. She's like, you really do that? I said, yes, you that's straight up. You have to. Colchicine and gout. What's colchicine?
Good question.
Long-term,
That's what?
long-term therapy.
And long-term therapy for gout. What kind of teaching? I'm looking for 3 things that we have to teach our patient if we're putting them on colchicine.
Diet?
Huh?
Diet?
Well, besides fixing your damn diet, yeah. I'm thinking about just the drug. Side effects of the drug are
Changes the color of the urine.
changes the color of the urine. What else does it change the color of?
Stool.
Stool. What's a side effect of too much colchicine? That's the end effect, but you gotta go through a few steps before you get there. Huh? Muscle pain.
Muscle what?
Muscle pain. Colchicine toxicity will cause muscle pain. Why is it causing the muscle pain? Because it's breaking down the muscle. Side effect of breaking down the muscle.
Breaking down the muscle?
What is the side effect of breaking down muscle?
Pain.
Huh? Rhabdo. Rhabdomyolysis. That's what kills him. Rhabdo. Myolysis. And the last thing I want you to know about and be able to apply. Are you ready? What's that about?
Cancer drugs? Is it cancer drugs?
Cancer drugs? No. Caution.
Proceed.
Caution. What did we use caution about? Signs and symptoms of skin cancers. Caution. Go to your slides. I just did that.
Changing bowel or bladder habits, a sore that's not healing, unusual bleeding, thick lumps, indigestion or difficulty swallowing, obvious change in molar or negative cough or hoarseness.
Bumping right back over your roll
Yeah.
kidney.
Thanks.
Think on the side.
No.
Indigestion.
Yeah, indigestion.
And I'm not talking about I ate Thai food, so I got indigestion from dinner last night. I'm talking about long-term, just hanging out, causing a problem. What I would look at everything, I wish you guys got to see me do just a whole bunch of old stuff all over again, but I get this, you never taught us caution. And I'm like, I know I did, because I'm doing it again. You didn't teach us about literacy. Yes, I did.
Caution is for all cancers, right? Not just.
It's for a bunch of different cancers, yeah. The nagging cough is the one that scares me. Esophageal and throat cancer. Questions, comments, concerns? Do y'all know where to upload your stuff? Did you find where to upload your stuff?
No.
45 questions and 5 math.